Good afternoon, everyone. My name is Daksh Sadaria. I am from second year B physiotherapy student, and my today's topic is lung carcinoma. Lung cancer is a type of cancer that begins in the lungs. Your lungs are two spongy organs in your chest that takes in oxygen when you inhale and release carbon dioxide when you exhale. The etiological factors of the lung carcinoma are the tobacco smoking, industrial hazards. In the industrial hazards such as asbestos, arsenic, chromium, uranium, nickel, vinyl chloride, mustard gas, these are the possible risks that can cause the lung carcinoma. Air pollution such as air particles and radon gas, molecular genetics, dietary factors such as vitamin A deficiency, chronic scaling or TB, chronic intestinal fibrosis or infarct, adenocarcinomas are the etiological factors. The risk factors: smoking. Your risk of lung cancer increases with the number of cigarettes you smoke each day and the number of years you have smoked. Quitting at any age can significantly lower your risk of developing lung cancer. Exposure to the secondhand smoker. Even if you don't smoke, your risk of lung cancer increases. If you are exposed to the secondhand smoker, means if you stand nearby the person who smokes, you also get the risk of high lung cancer. Previous radiation therapy. If you undergo any type of radiation therapy to the chest or any other type of cancer, you may have the risk of getting lung cancer. Exposure to the radon gas. Radon is produced by the natural breakdown of the uranium in the soil, rock, and the water that eventually becomes part of the air you breathe. Unsafe levels of radon can accumulate in any building, including homes. Exposure to the asbestos and other carcinogens. Workplace exposure to the asbestos and other substances known to cause cancer, such as arsenic, chromium, and nickel, can increase your risk of developing lung cancer, especially if you are a smoker. Family history of lung cancer. People with a patient, sibling, or child with lung cancer have increased risk of the disease. Now discuss about the pathophysiology. The etiological factors can affect the partial obstruction of the lung wall, can lead to the obstructive emphysema of the lobe, which further lead to the infection of the lobe, can lead to secondary abscess formation, can lead to involvement of the pleura, can lead to extension of the chest wall, can lead to the intercostal nerve or bronchi inside the lungs, and lead to spreading in the mechanism and the compress the underlying structures, can lead to metastasis. The symptoms. The symptoms of the lung cancer does not cause any specific signs and symptoms at early stages. The signs and the symptoms of the lung cancer typically occurs when the disease is advanced. Signs and symptoms of lung cancer may be such as cough, cough, coughing with the blood, even a small amount or so, shortness of breath, chest pain, hoarseness, losing weight without trying even, bone pain, headache. Complications. Shortness of the breath. People with the lung cancer can experience shortness of breath if cancer grows to block the major airways. Lung cancer can also cause the fluid to accumulate around the lungs, making it harder for the affected lungs to expand fully when you inhale. Coughing of blood. The lung cancer can cause the bleeding in the airways, which can cause up to cough up blood. Sometimes bleeding can become severe. Treatments are available to control the breathing pain. Advanced lung cancer that spreads to the lining of the lungs or to another area of the body, such as bone, can cause pain. Tell your doctor about your experience, as many treatments are available to control the pain. We can diagnose the lung cancer by the X-rays, CT scan, MRI, sputum cytology, tissue sample biopsy. Thank you.